Although it can be a severe disease, heart failure is not a death sentence. For more on that and the latest in treatments, I'm joined by Kismet Rasmusson with Intermountain Medical Center Heart Institute. Thank you so much.
Thanks for having me.
So, heart disease is the umbrella over heart failure. Define that for us. What is heart failure?
Heart failure is a condition that is really a syndrome of symptoms that people get when the heart is either weak and not squeezing well, or it's stiff and doesn't relax well. And you really don't know what type of heart failure somebody has unless you get some imaging, say with an echocardiogram, to understand the function and the structure of the heart.
And so what are some of the symptoms before someone might see a doctor? What could be heart failure symptoms?
The most common symptoms of heart failure are fluid retention. Many people are short of breath with that fluid retention. They may have swelling in the legs, feel bloated in their abdomen. They may have difficulty with breathing when they lay down. A lot of people have fatigue. They just feel like they can't do what they used to be able to do.
Is this more of a weakness of the heart, and it's just not pumping enough? What exactly is going on?
So that's a great question, because a lot of people misunderstand what heart failure is, and there are different types of heart failure. So the weakness of the heart is one type of heart failure where it's really not squeezing well and not squeezing normally. The other type is when it really doesn't relax well. And with either type of heart failure, people can retain fluid and have those very similar symptoms that I described.
And when you're talking about a weakness of the heart, you can also strengthen it on that end, right?
Right. There are very well proven medications that can strengthen the heart muscle. We use proven medications like ACE inhibitors or their cousin angiotensin receptor blockers, or ARBs, beta blockers, and other medications that, when taken and used at the maximum doses, can really improve the heart function in many people.
How big of a problem is this? I mean, heart disease is the #1 killer, but how big of a problem is it in our community across the country?
Right. In the United States, there are about 6 million people that have heart failure.
Wow.
In Utah, it's probably about 60,000 people. We really have information from our hospitals about heart failure. That's the most robust data.
And when you're more involved in heart failure, what happens? What happens if it goes untreated and we can't get to the crux of the problem?
Right. People have incredible symptoms that continue to progress. So if somebody is short of breath and they're retaining fluid and they're not on a water pill to help them get rid of the extra fluid, then they get more short of breath and really, tend to balloon up, we call it, with extra fluid. And they become very symptomatic. And then they will be hospitalized. And if the heart function is really critical, then some may go on to die.
Three things that you can tell folks at home who may be on medication but also can do things on their own, say their diet, things like that.
Yeah, that's a great question. I think some of the most important things for heart failure patients to do is take their medications as they're prescribed, unless they're having problems with them, and then they need to talk to their provider. They need to monitor their weight because of that fluid retention. We want to keep people at a weight where they're not retaining fluid. So rapid changes in the weight can be reflective of changes in fluid retention. And we want them to follow a diet that's low in salt and low fluid, and really understand what's going on with their symptoms so that they can contact their provider early if they're having some changes, so that we can alter the therapy and prevent them from going in the hospital and getting worse.
Excellent. We'll have much more on our website at goodforutah.com. Glenn, back to you.